good morning. It's great to be at Lakewood Ranch. I want to recognize Commissioner Cruz and Baugh, and also Bill Galvano, a good friend of mine who did great work. Want to provide an update on this week's vaccine shipments. It's not a great day here in Florida weather-wise, but it's a heck of a lot worse in a lot of parts of the country. And so vaccine shipments are being delayed. Now, we did get the vast majority of our Pfizer shipment this week. We've received about 136,000 doses. We've got about 9,000 doses that are left. We think we're going to get those tonight or tomorrow morning. So that's not that disruptive. The Moderna, though, that entire shipment is still yet to come. So we think it's going to come hopefully by Thursday or Friday. Normally we would have all the Moderna by Tuesday or Wednesday of each week. So, and what's happened is you see all the storms, you see a lot of the ice. I think some of this stuff's just in Memphis or the places where they ship from. So it's a combination of the weather, the ice, and then obviously the different logistics that result from that. So if you have an appointment like at a Publix for Thursday and they have to delay you, that's almost assuredly why. So just have patience on it. There's nothing we can do with the weather in other states. We are going to get the Moderna, but it is not here when it normally would be here. Also want to just provide an update. We're happy to be here at Lakewood Ranch. This is one of our senior community pods that we've been doing all across the state. And this is for 3,000 vaccines for seniors age 65 and older. They are going to get Moderna. They will be scheduled to come back here for their boosters in 28 days. And we want to thank Lakewood Ranch and Manatee County for working with us. What we did as we got into February was we looked at what percentage of seniors in each county had gotten shots to that point. Because we had about 4 weeks of really strong seniors first where we were getting the vaccines out. And yet some places that were in the 40% of their seniors. And now, a couple weeks later, we have some that are going to hit 70% soon, like St. Johns County. They're in the mid-60s. Palm Beach, big county, I think it's 54%. But we had seen Manatee, Sarasota, and Charlotte counties as being in about 20%. So we said we've got to do more in those three counties. And so here in Manatee, I mean, the county, they're already getting 6,000 for their pod every week. That continues. So this is in addition to that. But what we've done over the last 2 weeks is we've done senior community pods in each of the three counties. We did 3,000 seniors at the Venice Community Center last week in Sarasota County. We did 3,000 at Kingsgate down in Charlotte County, and then obviously here at Lakewood Ranch. We've also seen an expansion of Publix into these counties. Now, Charlotte did have Publix for a few weeks, but you now have 17 Publix and one Winn-Dixie in Manatee, and then 22 Publix in Sarasota. So the percentages have gone from 20 to about 30, and Sarasota's a little higher than that. So we want to keep it going and keep the momentum going. So of the 3 events that we've done just in the last week or two, that'll be in almost 10,000 additional doses. And again, this is not diverting from what the counties are getting. This is over and above. We've done these in other parts of the state. Palm Beach County, we've done them in Hillsborough County, we've done them in Sumter County, and we're going to continue doing that. So in 3 counties, you have almost 10,000 for these senior community pods. Then you have 46 Publix and one Winn-Dixie for the 3 counties. We're also working with Walmart as the federal pharmacy program increases. We want to ask Walmart to get involved in some of these counties as well. So stay tuned for that. But we're at the point now where, because the numbers lag in terms of when it's reported, and you're going to probably see even more lag because of the delayed shipments as well. But we're already reporting about 1.8 million seniors, but we're hitting 2 million pretty close in terms of seniors that have gotten a shot. And so that's the 75% of all doses have gone to senior citizens in Florida, and we want to continue to do that and just press forward. There's still strong demand for it among seniors. We do anticipate next week, as of right now, that we will see a net increase of 41,000 doses above and beyond what we got, what's due to come in this week. Obviously, we haven't gotten all the Moderna yet, So that'll be 41,000 additional. So that'll allow us to increase doses in counties that need it, to try to catch up. So we haven't made the decisions about where those are going to go, but I would imagine you'll see some in Manatee and Sarasota and Charlotte above and beyond what they're normally getting. You'll start to see, starting next week, the numbers of distributed doses increase even above and beyond the new doses. And basically what the federal government's decided to do is count the Pfizer vials for that 6th dose. Up to this point, it was 5. So now they're saying if you get a Pfizer vial, that's 6 doses. So people should just understand that that's part of what's happening. So the 41,000, that's new net doses, not including the change in definition there. So whatever we're getting 41,000. Now they'll show that that's even more because they're going to do the 6 doses in the Pfizer vial, which is fine, but that's just understand what that is. So we're going to continue doing our relationships with faith-based communities. We've done over 70 houses of worship in different faith-based communities. We've cranked out about 40,000 shots. A lot of that is African American churches, but we've also done synagogues and mosques and other houses of worship. We also have, between county health departments and the state, 105 community vaccination sites statewide. These communities, senior communities that we've done over 15, I think now, starting in Kings Point down in Delray Beach in December, and we've been in different pockets of the state doing that, and we're going to look to do more going forward. We also have our Homebound Seniors program. So we've been able to go and visit seniors who may have more difficulty getting out of the house, going to a site like this. And we started with Holocaust survivors. We moved on to Bay of Pigs veterans down in Miami with the Cuban Americans. And we've been working diligently to do as many World War II and Korean veterans as we can. I was in Charlotte County last week, and we had a great fella who was 94 years old who had served in World War II and Korea and Vietnam, for that matter. So we're going to continue to do that. The federal pharmacy program last week was the first week that it had been going. We got a lot of positive feedback. Obviously, Publix had been involved in our efforts in getting that into communities. They got additional doses through that. And then Walmart, with over 119 or about 119 Walmart and Sam's Club stores across 34 counties. So I think folks appreciate that. As I said, we'd like to be able to get Walmart expanded into other areas as well. And as the doses increase, if the doses increase, we're going to do that. We are very robust with Publix, almost 600 stores now across 41 counties, including 17 right here in Manatee County. And people can sign up for that at publix.com/COVID vaccine. We've also, my Division of Emergency Management, I've told them to work with FEMA. They have set up some sites in California. And we say, look, we want more doses however you're going to do it. I've been very clear. The easiest thing is just to send us more because we have the infrastructure. If they want to come in and set up and they're going to do doses over and above our current allotment, we obviously want to participate in that because we want as many doses as possible. So hopefully that they'll be able to do something here in Florida as well. And I think the way they do it, I mean, each site is tens of thousands of doses a week. And so if you're talking about setting up a handful of sites, that could be 50, 60, 70,000 additional doses a week. So we obviously want that. We want to make it available for everybody. And then we're also monitoring the approval for the Johnson & Johnson vaccine, which will hopefully, if produced to a large scale, will make a really, really big difference and provide another option for folks. I think what you'll start to see, hopefully, over the next couple weeks is there'll be a little softening in the demand among seniors. Now, there's still very strong demand because we've got 4.5 million seniors and you got many that want it. But I think that as you do more and more chunks, and if we are getting 400,000 a week, that's going to make a big dent in that. So I think you'll start to see a little bit of softening. And then once we see that, that's when we will expand to either other age groups and or some of the key areas like law enforcement. We also are happy, though, that like everywhere in the country, you're seeing pretty big declines in hospitalizations for COVID, emergency room visits, and I think you're going to continue to see that. Is that because of vaccine yet? I don't know. I think it's probably more just the natural seasonal pattern that this virus has done. It's interesting. You watch some of these people talk about, oh, well, people just started behaving all of a sudden. Really? Like the whole country just started behaving better no, it's a seasonal pattern, very consistent in terms of when it goes up and goes down. So I think that's probably most of it. But I do think we're going to start to see some of the effects of the seniors first strategy with the vaccinations, hopefully over these next couple weeks. And so if you're declining, does it hasten the decline amongst senior citizens in terms of cases, hospitalizations, and obviously mortality? And if we see that, then we know that these vaccines are doing a good thing. Israel seems like they've had the seniors for the hospitalizations have fallen off a cliff. Of course, they vaccinated a huge percentage of their seniors very quickly. They did a great job, and you are seeing that. For us, I think it's going to take a little bit more, but by March, I think we're going to have a really good sense of the efficacy of this, and I'm very optimistic. It could be part of what we're seeing now across the country, but I think probably these last 2 weeks of February are going to be the key thing. So we're going to continue doing this. As soon as we get that Moderna in, obviously it's going to go to where it needs to go. There is, unfortunately, a delay on that, so I just ask folks to be patient. It's out of our control, and hopefully they're able to get that to us very, very soon. But we're really happy to be here at Lakewood Ranch. We're happy that we're going to have 3,000 seniors come through this site over the next couple days, and even with some of the problems with the delivery, this is something that we had committed to do. We wanted to do something in all 3 counties, and so we were able to pull it off, and we're happy about that. Okay, anybody have any questions? Yes, ma'am.
Hospitality Channel 8, I know you like to make decisions based on the evidence, Governor. There's way more cases in other parts of the county. Zip code 34221 has more than 4,300 cases. Can you commit to doing a pop-up site just for those residents as well?
So we're not limiting it necessarily, so the 6,000 doses that go to the county as a matter of course.
This is limited though.
Exactly. This is in addition to what is normally sent. So we. Okay, am I going to answer? Okay, thanks. So you asked your question, now let me answer. So the 6,000 doses that go to the county, that is able to be apportioned how they see fit. So if that's an area they want to go, absolutely they can do it. We also have the Publix, which is spread out all across the county, that are able to do it. These doses were not earmarked for Manatee. These were general doses that we were using to supplement what was already done. And so the reason why you do these community pods like we did at Kings Point down in Delray is because you can go in quickly. You ask the communities to provide the folks, you rush it through, and you can do thousands in a few days. And so we're going to continue to supplement. If we do get the 42,000, 41,000 additional doses, I'm pretty confident that you'll see more. You'll see a chunk of that in Manatee, Sarasota, and Charlotte.
Governor, specifically to the 2 zip codes that were chosen, it was a very contested topic in the commission meeting last night. There's 3,000 additional doses. Those 2 zip codes, people are upset, Commissioner specifically, that it's honed in on those 2.
So would they rather us send it to other counties?
The question is, who specifically made that choice to hone in on those 2 zip codes?
It wasn't a choice about zip codes. It was a choice about where's a high concentration of seniors where you could have communities provide the ability for them to go on. It wasn't choosing one zip code over another. If there's another community that has tens of thousands of seniors that you can work through, we've done this in places like Sun City Center. We've done it in Kings Point down in Delray. We did it in Solavita in the Polk Osceola area. Obviously, we've done a lot in the villages. And so go where the seniors are, try to knock it out. But just understand, if folks here are complaining about doing a pod, this is additional to what the county's getting. So I think most people want to have more vaccine being delivered. I think this is a good setup. I think you're going to go through and get a lot of folks who are going to be able to get shots that may not have gotten shots this week if it wasn't for us. And so we believe in being nimble and expeditionary, and I think it's working out very well. We had a lot of cooperation, and that's the thing. For us to come and bring the doses, we have the logistics, that's fine. If there's an orderly process for the folks to come in and they can work with us to do it, that really makes all the difference.
You didn't answer the question though. Who specifically made that decision?
There was no choice to pick certain zip codes. I did answer the question. It was, we wanted to find communities that had high levels of seniors living in there, and this obviously has a high concentration. You look at all these different communities and there's a lot of senior citizens. If there were few senior citizens, then you wouldn't have set up a pod here, but you did it because there's a lot of senior citizens.
But Governor, we've seen that seniors are willing to travel very long distances, certainly to the next zip code over, and specifically we have been...
And there's options to do that, right? I mean, aren't there?
But in this specific location, only 2 zip code residents were given the option to come here today, and I'm sure many more would have traveled from all over those.
And these aren't the only choices. This is in addition to everything else that is provided to Manatee County. And so you have 6,000 doses every week that are going to the county. You have thousands of doses most likely that are doing in those public stores. I mean, if they have 15, 18, however many there are, I mean, they're doing probably 50 a day at each store. So you have those options as well. So again, this is not in lieu of any of that. This is totally supplementary to that, and it was done to be able to make sure that folks are able to get in here very easily. There's a high concentration of seniors, and so you're able to use it there. But look, I mean, if Manatee County doesn't like us doing this, then we are totally fine with putting this in counties that want it. And we're totally happy to do that. So anyone that's saying that, let us know. If you want us to send to Sarasota next time, or Charlotte, or Pasco, or wherever, let us know. We're happy to do it. But I think most people, if we have an opportunity to bring vaccines and do it efficiently, I think that they're going to want it. And so, there's going to be folks that are going to complain about getting more vaccines. I'll tell you what. I mean, I wouldn't be complaining. I'd be thankful that we're able to do it, because you know what? We didn't need to do this at all. We saw a need. We want to get the numbers up for seniors. And so the logical thing was, let's go to where there's a high concentration of seniors.
Governor, the developer of Lakewood Ranch donated to your campaign. A member of the Uline family, which owns Lakewood Ranch, donated to your campaign. Are you rewarding politically connected donors?
How are they being rewarded?
Well, I mean, they get an exclusive vaccine clinic for people who live in their community.
Okay, what is that? What benefit is that to I don't understand the accusation.
Get the vaccine, isn't that a benefit?
Well, anyone getting a vaccine, I mean, I think seniors want it, and so the question is, are we going to try to vaccinate as many seniors as possible? And I think we're doing that, and so I don't think there was any type of benefit for that, but I do think that this is something that is going to be very successful. I can tell you, every community pod we've done where we've gone to senior-heavy communities, people have really appreciated it, and we're able to get through a lot of folks very quickly, and we're able to be nimble and move it across the state. We typically do 2 of these every week in different parts of the state, and again, we're looking for places that have high concentration of seniors, and that's really the number one priority for what we're doing.
Governor, I think the question is whether or not this is equitable.
We heard yesterday from county commissioners that there are 2 different areas and different districts that have a higher population of seniors, and mobile home parks in other areas. Are you considering maybe...
Okay, but here's the issue. First of all, if they want to set up something, they want our help, we can provide. They're getting doses to do that if they want to. But, when you have senior communities, so like Sun City Center, right, in Hillsborough, you're able to show up, they can tell all the seniors to go, and you get it done. If it's disaggregated, it just makes it more logistically difficult. Doesn't mean you can't do it, but it isn't the same. This mission is really kind of the plug and play, go to a senior community and do it. And so we rely on the help. So when we're in Sun City Center, they worked with the emergency folks. When we were at Kings Point, the folks at Kings Point down in Delray, they worked with folks to get everyone in line and get it going. And so that's why you're choosing some of the senior communities. But we're going to continue to do stuff in Manatee. If they do not want more vaccine here, just let us know, and we will make sure that it goes, because there's a lot of people that want the vaccine. And I can tell you our reason for doing these pods in these 3 counties was because the 65 and plus population percentage who had shots was lower than the state average. And in some cases, a lot low. I mean, you have some counties that have had 65% of their seniors have already had a shot. And there's probably different reasons for that, but some of them have done a really good job. So we saw a need and we're able to meet the need, and I think that I think it's probably going to be good. I think everyone that's going to go through here today is probably going to be pretty happy, and we're going to look to do more with the additional doses. But anyone in Manatee, if they don't want us doing it, then just tell us, and we'll make sure that we send those doses to folks who want it. Thanks.
Governor, I think